Hola, bom dia, good morning to everyone. Thank you so very much for your kind invitation, and it's such a pleasure and honor to be with you this morning. My name is Csaba Dégi. I am secretary at the International Psycho-Oncology Society and also director, board member at the European Cancer Organization. And soon you are going to find out that I am also a co-chair of the Quality of Life and Survivorship Network at ECO. So, our morning presentation, it's just about to start. The topic of my presentation this morning is about COVID and cancer. It is about a 2 years long experience with a special focus on the European experience, including Portugal. And also you are going to see the shifting perspectives in psychosocial care of persons affected by cancer as we move along with the presentation. 2020 was officially the year of COVID. So we need to understand this unprecedented change in oncology. So we certainly need to quantify key aspects of the impact of SARS-CoV-2 on cancer on a European and pan-European level. For this, we are using the COVID-19 and Cancer Data Intelligence Center from the European Cancer Organization, which actually started to monitor and to present the impact, the multi-layered impact, starting from the first months of 2020. Let's see what we can see layers by layers. So we start with the impact of COVID-19 on cancer patients, as seen by doctors in the clinical area. So what we know at this point is that clinicians across Europe saw 1.5 million fewer cancer patients in the first year of the pandemic. 1.5 million fewer cancer patients. And if we calculate at the current rates, an estimated 100,000 cancer patients are added to the backlog every month in the European region. So, also in this area of patients seen during pandemic, urgent cancer referrals were cut by up to half due to the pandemic situation. So we are talking about a generation of missing cancer patients, even when we adjust our data to those from the World Health Organization. On the second layer, we see the impact of COVID on cancer screening. There is an estimated 100 million cancer screening tests that were not performed in Europe as a result of the pandemic change. And of course, this is already making effects as negative as possible in leading to later stage diagnosis and decreased overall survival. Most of the European oncology experts interviewed by the ECO agreed that it could take at least 12 months to clear this waiting list, the backlog of people waiting to be screened for cancer all across Europe. Moving on the impact of COVID-19 on cancer diagnosis. We see clearly that 1 million cancer patients couldn't be diagnosed or could be undiagnosed during this period. Actually, up to 1 in 2 people with potential symptoms of cancer were not urgently referred for diagnosis. 1 in 2. And of course, this is due to the backlog of screening tests, as we discussed it earlier, reduction of delays in referrals, and restricted healthcare resources or shifting healthcare resources due to the COVID-19, which is again the case with the fourth wave of the pandemic, just emerging in most of the European region. So, due to this disruption of early cancer detection programs, right, for example, for breast cancer, cervical cancer, colorectal cancer, patients are already being diagnosed with more advanced cancers. On the next layer, we find the impact of COVID-19 on cancer treatment. Treatment delays due to COVID-19 situation in 2020 affected 1 in 2 cancer patients in Europe and continue to affect at this point 1 in 5 cancer patients. That means that 1 in every 5 cancer patients in Europe is currently still not receiving the surgical or chemotherapy treatment they need. Also, an estimated 1 in 10 European cancer patients are not receiving the radiotherapy they need due to the concerns and shifting needs around COVID-19. A surgical delay of 12 weeks for all breast cancer patients for a year could lead to 12,000 excess deaths. 12,000 excess deaths across Europe for breast cancer. Due to the fears of contracting the COVID-19, also patients are less likely to attend follow-up visits for the early stage cancer treatment. Moreover, we are also talking about patients' fears when it's about fear of cancer recurrence. Actually, a small percentage, around 12%, stated that fearing infection with coronavirus more than the oncological progression, while 26.5% of participants in the study were more preoccupied about cancer evolution. But, and this is the highlight of this study, is that the majority of the responders, cancer patients, survivors, actually almost 62%, were fearful of both the coronavirus infection and also fear of recurrence of cancer. So as we can see, these are just added burdens. We have to discuss about the impact of COVID-19 on cancer workforce. The pandemic has taken its toll on healthcare workers, as data shows 4 in 10 feeling burnout and 3 in 10 reportedly showing signs of clinical depression. It's also very important to underline that the pandemic situation has also been an impetus for positive changes in working practices, technology adoption, reducing process barriers, and fostering collaborations which, have the potential to be sustained in the following years. So we have seen, besides the burnout, that technology has been embraced in many practice and research contexts in oncology, and in supporting new ways of working with cancer patients and their caregivers. Impact of COVID-19 on caregivers was documented on a more global level, but also on the in the European context. The Global Carer Wellbeing Index from 2020 shows us an unprecedented impact on informal and also unpaid carers. So as a result of the pandemic, one in every five unpaid carer around the world began their responsibilities. And yes, they are, or they tend to be, younger. They are from the new generations, Gen Z or millennials. And before the pandemic, the average carer offered on a global level 16.6 hours of unpaid care a week. And during pandemic, that figure rose to 23.4 hours in 2020. And carers expected it to grow to more than 28 hours per year in the future as the result of the ongoing pandemic. Because of the time commitment as a caregiver, 62% of the working carers are worried about losing their jobs. Actually, the double carer roles already overburdened them before pandemic. Also from this Global Carer Wellbeing Index, we know that there is an undeniable strain on informal and unpaid, very important, unpaid carers. During the pandemic, 89% of carers stated that they prioritize the needs of the persons they are caring for above their own needs. Caregivers of cancer patients are at increased risk for isolation and loneliness. 76% of the caring say caring for others during the pandemic has made them feel more burdened than they have been in the past. Because we know that even before the pandemic, burnout among caregivers was widespread. The pandemic has actually just made that worse, exacerbated 61% of the carers' mental well-being in general, and women in this regard are particularly affected by emotional health issues. And also very important, 58% of caregivers say that their mental health suffers as a result of their duties in the caregivership. Eurocarers shows us from their research that about 60% of respondents say that caring has a negative effect on their health as caregivers and that they do not feel that during COVID-19 they have been valued by society. The pandemic has had the greatest negative effects on the following aspects: the social life and social participation, quality of life, physical and mental well-being, access to health and or social services. Also, it was recorded an increase in the amount of the medical and emotional support offered by caregivers in a European context. Smartphones, social media, computers, tablets are all being used extensively and ongoing during this pandemic period. Due to the outbreak, 20% of caregivers, according to Eurocarers, lost their jobs or had their working hours cut, and certainly their income decreased. That was 2020 and the multi-layered impact it had on the oncology screening, diagnosing, treating and supporting services, as well as patients and their caregivers. 2021 was a year which might have a very long-standing impact on cancer policy and the life of all the citizens impacted by cancer, the cancer experience in Europe. 2021, it is undoubtedly the year of cancer in so many positive senses. Actually, on February 4th, Europe's Beating Cancer Plan this year was officially launched, and it has a fourth pillar, the quality of life and survivorship pillar. And as you have seen, and I am also sure that you're aware of, survivorship and quality of life are admirably central to the EU Health Commissioner, Stella Kyriakides, a true survivor herself. And this is actually one of the core parts in the vision for a cancer-free Europe. So, Europe's Beating Cancer Plan just moved mountains at the beginning of this year. And in the second half of this year, we do all that we can on a European level to not let COVID-19 stop us from tackling cancer. So it's not just the plan, it's the action that we do with our plans. So we are going to come back to this and to talk about time to act. At this point, I would like to introduce the Survivorship and Quality of Life Network from the European Cancer Organization, which brings together patients, healthcare professionals, academics, charities, foundations, and our community 365 to highlight and promote opportunities for pan-European improvement in the way the health system and society in general take care of the survivorship and quality of life challenges faced by persons affected by cancer, their loved ones, and families. In this very special network, we have, two main ways to deal with these issues. One is focused on the physical needs, and the other one is focused on the psychosocial needs. We are going to, share with you some of our best work streams and also position paper launched on this topic. But first, let me introduce my co-chair, who is Dr. Andrew Davis from MASC, from the Multinational Association of Supportive Care in Cancer. He is in charge of the physical track, and myself from the International Psycho-Oncology Society on the psychosocial track. The network, of course, builds on excellent projects and initiatives that already were advanced by participants in the network. And also we try to highlight and amplify and echo the important areas that have an established consensus for progress in survivorship and quality of life. Here you can see the members of our network, including the International Psycho-Oncology Society, but all the other representative societies, and our list is growing by months and years. The network provides continuous support for implementation of the right to be forgotten. Also, it's very important to us because it was one of the European Cancer Summit resolution in 2018 on financial discrimination, or actually non-discrimination of cancer survivors, which was initiated by Professor François Monnier and in close collaboration with her. So, our united view is to establish a right to be forgotten for cancer survivors when seeking to access financial services in Europe. It is already well established in France, Belgium, Luxembourg, and this year, most recently, in Netherlands. And of course, we highly advocate to be codified in all European countries. So we hope that Portugal is going to be soon the next country to be committed to right to be forgotten. One of our first initiatives was about strengthening Europe in the fight against cancer. This was one of the major outputs of the European Cancer Organization on cancer survivorship and quality of life in 2020. Actually, it was, the publication of a landmark study called Strengthening Europe in the Fight Against Cancer, Going Farther and Faster. And it was commissioned by the European Parliament, and it's very important that it was actually a current state of affairs in oncology. And you can download it, of course, from the European Parliament's website in English and other translation. It's very important to state that it was compiled with input from 61 experts over a half an year period, and this landmark study for the European Parliament included 45 recommendations, strong evidence-based recommendations for the Europe's Beating Cancer Plan, the EU Cancer Mission, and some of the projects that are associated with this very important landmark documents, like the new EU Pharma Strategy and EU for Health program, which has already opened its door. In this comprehensive EU document, actually we investigate where matters currently stand in respect to causation and prevention of cancer, policy needs for achieving earlier detection and earlier diagnosis of cancer, including very important screening strategies in the European region. Also, looking for means by which we can improve, cancer treatment and care in Europe, and research which is crucial in the Horizon 2020 calls as well, which we can see it now. Also, we are talking about specific requirements, or we call it at ECO essential requirements and opportunities for progress, including rare cancers and childhood cancer. But also, if you check the essential requirements documents from the ECO website, you're going to see that we have it also for breast, lung, and so on. We were, in this last 2 years, strongly linked with the new European Code of Cancer Practice. So we have in this new European Code of Cancer Practice, we have 10 points, which are equal access, information, quality, expertise and outcomes, specialized multidisciplinary care, shared decision making, first 5, research and innovation, very important to us, 7, quality of life, 8, integrated supportive and palliative care, 9, survivorship and rehabilitation, and 10, reintegration. So these are the 10 points of the new European Code of Cancer Practice. And actually you can download it in Portuguese as well. And we at the Survivorship and Quality of Life Network are, collaborating but also proud supporters of the European Code of Cancer Practice. One of our latest documents is Free from Cancer, Achieving Quality of Life for All Cancer Patients and Survivors in Europe. It was commissioned by the European Cancer Organization, and it's actually a new 7-point plan, which is available to download at the ECO website and also Hub on the Wonder Medical platform. And actually it's presenting, a ground of timeliness for European health systems to improve their readiness for the present and future realities of increased cancer survivorship. So now let's see these 7 points that you can also read with, data and references together in the study. First one, very important and very dear to us in the Psycho-Oncology family, take action on cancer distress. Take action on cancer distress. Second point, elevate management of pain and other symptoms, which are, or should be the core parts of a cancer patient pathway. Third one, yes, cancer patients have their sexual life. So, cancer patients and survivors have sex lives, and we should recognize sexuality in our health system approaches. The fourth one, it's about cancer comorbidities and complication. This is an ever-growing challenge in oncology, which needs additional focus because of the complications that are also arising with the COVID situation. Empower cancer patients and survivors. Importance of education and information are just too strong to lack focus. So, yes, we need to empower cancer patients and survivors with education and information. Sixth one, provide cancer patients and survivors with the right to reintegration into the workplace. Cancer and work are a must for those who are seeking to make sense of their working life. And seven, we have to ensure cancer survivors have a right for their cancer to be forgotten by financial service providers for 5 years or after 5 years or after 10 years. That it's a very important issue that we have to deal with when we talk about a new normal for cancer survivors. As you see, 2021, including the second half of this year, it's full of action. In this inspiring and energetic context, in a few days, you are going to be part of the Time to Act campaign, which on 27th of October is going to be in Portugal, the national campaign. And actually the main message is, don't let COVID-19 stop you from tackling cancer. The Time to Act campaign is presented in over 30 languages on a pan-European level. And now it's your turn, Portugal. So this is a very kind invitation. Let's see it together.
É tempo de agir em toda a Europa. O cancro não espera que a pandemia passe. Então, é seguro fazer os rastreios para o cancro da mama, para o cancro coloretal, para o cancro do colo do útero. Não falte às suas marcações. Se tiver algum sintoma suspeito, não hesite em procurar ajuda médica rapidamente. O cancro pode ser curável se for detectado precocemente. Por isso, não perca tempo e não deixe que a COVID-19 o impeça de enfrentar o cancro.
So, please, join us for Time to Act Portugal. Also, looking forward for future events, the Survivorship and Quality of Life Network hosts a very special session at the European Cancer Summit 2021, which has the title From Plans to Action, on 17th and 18th of November 2021 in a hybrid format. And we would like to warmly welcome you to our session. This is going to be a panel discussion on survivorship and quality of life with very important key opinion leaders and also very important and dear friends like Lucia Travado, President Emeritus from the International Psycho-Oncology Society, Matthew Lo Scalzo. Professor Lo Scalzo is from the United States, from the City of Hope. Also, Stein Kassa, Professor of Palliative Medicine in Oslo, Norway. Martin Inderbitzen. He is a neuroscientist and also the founder of mysurvivorstory.org, a very, very strong survivor story. And also Natasha Bolanos, member of the Patient Advisory Committee, which is very dear to us at the European Cancer Organization. So please join us at the European Cancer Summit in November. Here we can see a very short summary of the last one.
COVID-19 will have far-reaching consequences for cancer patients. Cancer care cannot be the responsibility only of the health sector. We need to address cancer in a holistic way. Each citizen deserves the same quality of care, the same access to new medicines, and the same innovative treatment. We can ensure that those who live with cancer don't only live long, but also live well. That COVID has acted as an X-ray for an already very vulnerable health system.
We need more Europe in health, to have more health in Europe.
The COVID-19 crisis has had and still has strong impacts on cancer patients. Cancer patients are among the most vulnerable, being at higher risk of serious illness and death from COVID-19.
Care for cancer patients is surely being delayed. It's time to reflect and think about the future of cancer care, because at the end of this pandemic, we will have to face unexpected problems in the approach to cancer.
The fight against cancer remains a top priority for the European Commission.
It is an opportunity to champion European solidarity for people living with cancer and to eliminate inequalities in cancer care.
Test of COVID-19 provides us with an opportunity to reconsider how we work together in the interest of our citizens. And by using all the possibilities and instruments we have, making use of science, solutions and solidarity, we can deliver health and prosperity to the people we serve, leaving no country, no person behind.
"2021, it's certainly about plans and actions and time to act. What about 2022? I think that 2022 will show us that there is no turning back. No turning back in changes and in action and initiatives that were developed during COVID. And actually, I think it's going to be a magnet for our work. And in this regard, I think one of the strongest points in 2022 will be reimagining psychosocial oncology. To see, after changes and shifts and shifting things, what is actually going to happen, what is going to stay, and what is going to, just be the no turning back point for us professionals, for persons affected by cancer, and also for policymakers. So in 2022, the IPOS, International Psycho-Oncology World Congress, is going to be in Toronto, in Canada, in August, end of August, start of September. And I would, kindly ask you to be with us to see how we reimagine the psychosocial needs, the work, interventions and research with psychosocial needs in oncology. And I made sure that all the content that I have presented and shared with you are, easy to reference, track, and download. And it would be just an added bonus to discuss with you and to have your questions. At this point, I would like to stop with my presentation, and I would like to thank you very much for your kind attention. Obrigado. Obrigado, Lucia Travado. E obrigado, Victor Rodriguez. Thank you so very much for both of you, presidents at this Congress. And I hope to see you in person as soon as possible, because I miss Lisboa very much. Thank you once more for the Portuguese League for fighting cancer. Of course, for your invitation, but more especially for being open and being welcoming for us who are involved in psychosocial needs and psychosocial challenges. Obrigado.